Good afternoon, everyone. Lieutenant Governor McKee, Secretary Gabea, Treasurer Magazina, Chairman DuPont, and I'm losing my train. Speaker Mattiello. It's one of those brain things going on. Bright lights are getting to me, Mark. It's all the technology. It's all the waves that are going out there, I guess, that they talk about these days. On behalf of the Committee of Healthcare, I'd like to thank you for joining us today. Especially thank you for your tremendous progress you have made in improving the business climate in the state of Rhode Island. We're moving in a very, very positive direction, and it's encouraging to see that happening. I also want to thank all the other elected officials that have come here today, as well as everybody in the business community that took the time out of their schedules to be here also. I really want to thank the committee that worked on this, obviously Melissa Travis and Steve Boyle, who are the co-chairs of the committee, Al Charbonneau, Jeff Grove, who couldn't be here today, Jamie Moran, and Erin Donovan Boyle. They really did a tremendous job in putting together a program that we think is going to be very, very, very good for the state. So we need to continue the progress that's been made, and our group agrees that we need to have a cost-effective, high-quality, innovative healthcare system that is critical to the success of the economic development of the state of Rhode Island. And we'll get into some of the numbers in a minute, which is actually in the report that we did on the Survey Monkey report. It's also an important factor in recruiting and training retaining new and strengthening existing small businesses, which are vital for the business climate. Prior to our meeting today, we sent out a survey to the business community, and we received 75 responses to that survey. Each of you have a copy of that survey in your packet, and there's also a copy that I've given to the DS. Pretty much, I mean, at times it was like, okay, well, the questions were kind of loaded in one direction, but the questions are reality, and the reality is, between 2006 and 2015, healthcare costs in the great state of Rhode Island have increased from 16.7% to 21.9% of the median income of the state. That is a 31% increase. I mean, to further take that along, which was not in the survey. Ultimately, when you look at what happened over time, any of the increases in salary that the workforce received in the state, I think over the past 10 years, between healthcare costs and basic necessity costs, something like 92% of that went to just healthcare and necessities. So that gave 8% to disposable income in the past 10 years. That's certainly not an economic driver by any stretch of the imagination. So getting back to the original thing, of the respondents, 80% of the respondents believe that this is impacting economic development and upward mobility in the state of Rhode Island. So it's pretty, the numbers pretty well tell it all on that one. 50% of the respondents would be willing to drive further to a hospital to reduce systems in the cost of the system by $30 million. And that would be by eliminating the 200 excess beds that we have in the state right now. 84% are in favor of revising the behavioral health system, which per employee is the highest level in the nation, by encouraging patient services versus outpatient services and performance-based pharmaceutical practices. 80% would support requiring an economic impact study for all proposed healthcare legislation and regulation. And I think that was a big, that came up this morning in the panel discussion. Let's look at the economic impact of what we do and see how that's going to affect the business climate, positive or negative. And 76% support leadership being more proactive in supporting a common sense solution to control the cost of healthcare. So in our group, we identified 3 areas that need to be addressed. Number 1 is determine a statewide plan of action to control healthcare costs. Number 2 is strengthening the statewide certificate of need practices. it always kind of amazed me. It's like we have radiology centers throughout the state, and it's like, the best practice would be to have one at every hospital that everybody would go to, and that would be the extent of it. So they're there 24 hours for obviously the patients, but they're also there for the consumers if they have to just go in for that treatment. And the last is identify and target premium cost drivers in the system. So those are the three things that we would like to focus on. So regardless of the fate of the ACA, and we're all worried about what's going to happen, obviously, we know changes are coming, we don't know what they are, we don't know what the income's going to be, we had all these questions that would have to be answered. We have to, just move forward. It's time for Rhode Island to move forward. We need to establish our own plan for a cost-effective, high-quality, innovative healthcare system. We also have to make sure that that we keep the Rhode Islanders that are currently have health care, which I think is in the 92 or 94% range. We need to keep them insured also, because a healthy workforce and a healthy state is an important factor. With health care moving from the second highest expense for the state, for small businesses in the state, to possibly the largest expense for many, the Rhode Island business community is asking for your support as we come together for a drive on a more affordable system. Unlike the ACA, which was designed for access to health care coverage, the health community will be targeting the cost drivers, the business community will be targeting the cost drivers of health care. We have identified the areas of inefficiency and ways of streamlining the Rhode Island healthcare system to reduce spending. We ask for your support as a business community organizes to address these cost drivers of healthcare. And, it's funny because Dr. Ladaro said something that I thought was very profound this morning. Basically, the state of Rhode Island has to reinvent itself in a positive way. If we go back to the 1800s, turn of the last century, 2 centuries ago, I believe Rhode Island was probably the most industrious, and I think it was one of the wealthiest states in the nation. And it seems like in a little over 100-year span, we've gone from the top to the bottom, which sounds like a Red Sox, but that's another story. Yeah, they came back in 1 year. So I guess, next year we're going to be number 1, so that's good. Thank you to the government. I want to again thank you for all being here today and for your leadership in our drive to make Rhode Island a state where business owners want to establish and grow their business and raise their family. Thank you all.